Hello guys, how are you doing today? My name is Dr. Adriano Araujo, and today I have a good point to discuss over here and the question is why to become an expert in the digital treatment plan actually with Invisalign and why this can be a game changer for your own office. So if you're new here in this channel, you can see my background in another video, but we are gonna have take some time here. It's actually usually will be a few minutes video just to bring some great points to improve our knowledge with orthodontics, of course, and that's the new way to learn with the internet. And actually I'm here in Spain, but I am from Brazil, and I'm here speaking English so everybody can understand. So it's an amateur way to share knowledge, but it's something that I like to do, and so let's keep it doing here. And let's go back for our point today. So I just put like 5. You can follow here, and that's another thing that I learned with the time with online courses. One thing if you're not watching me, you can just listen the speaker and see the slides. That's really boring, and after 5 minutes you are kind of want to go. And with this, of course, so you can see my reaction, you can see my expression, so become a little bit closer from the learning point aspect of view. And so I put 5 topics here, and why to become an expert with in that case with the CleanCheck software. And the first thing is to do less and get better results. The more you do it and for more often and more efficient you are, and to control all the tools, and more efficient you will be, you're gonna have better results. You can have more time to test your treatments options, and in the end it will be a shortcut. You can make your own mistakes inside the digital platform, and not do the mistakes or test options on the patient. So doesn't need to be like a genius to know that that's one of the main reasons that with the digital plan we can reduce, is the number 2, reduce the treatment time. Because like I said, for example, if you want to decide, if you want to know how much IPR you need in that patient, you have exactly the same amount. You can treat the patient with or without IPR, and you can treat with or without extractions, and to get to know all the tools and how to use the technician with you, and you're gonna say that it's a great thing. And to reduce the number of appointments, because remember, when you're planning with Invisalign, it's different when you're in your own normal fixed braces appliances. You have different phases. So the first one is the bonding, and then the alignment, and then you're gonna decide the anchorage, and then you're gonna start some retraction, or you're gonna fix the malocclusion, and later on you have the finishing, and then you need to remove the braces, and then you have the rotations. So you have a different, you're gonna plan your treatments in 5 different levels, and also in the 5 different time during the 2 years treatments, for example. But now you need to do all these 5, 6 in the same day, in the same time, and you're gonna approve like in the first, in the beginning of the treatment. So it's completely different the way you do your planning with regular braces, and now with the digital setup models, 3D with Invisalign, for example. And so you can reduce the number of appointments, because you decide when your patients are gonna change the trays, the aligners, and can be like on average most of the orthodontists do every 2 or 3, but you can do if your patient's live in another state in another country, or for some reason he won't be able to be in your office for the next like 10 or 20 weeks, you can set up that. And anyway, so you can organize how you're gonna run your treatments, and then and all these need to be done in the first week, in the first time you're planning. So it's one more reason that we really needed to spend time and talking about that and learning more. It's different. That's when you're going to start when regular treatment, that you just look, you know exactly what to do. You say, you know what, just take the impression and put some expander and let's keep going. I'm going to see the other patients. You can't do that with the Invisalign treatments, and most of people, they are doing. That's why they are not getting the right results, or getting the same performance as some other orthodontists can do with Invisalign, and you cannot. So we're gonna share here in this channel and how you can become an expert with Invisalign, and not just the planning, how the treatment, and how to have the other topic we're gonna talk now, improve your quality of life. Because like I said, in the beginning, you needed to have a lot of work done and to get your treatment plan and all the way that's supposed to be, to have a better results, and to run a treatment smoothly. But after you did that, and you're gonna have more time for you. Like for example, if you set up your appointments every 3 months, you're gonna see these patients 4 times a year, and so you're gonna have more time for you. If you want to have more time to treat more patients, it's okay for you. But the point here that I can now with Invisalign improve a lot my quality of life. Actually, I'm living in another country for a while, so how would be possible you do that on the past? So you probably won't. You say, or for the most orthodontists, they cannot even be 1 day or 2 or 1 week away from the office. That will be like a disaster. And I have been here for 4 months, and in my office it's running smoothly. Of course, that I have this in-cloud way of treat my patients that I'm gonna share here as well in the future. And once you have improved your quality of life, of course you're gonna have what? You're gonna increase your profits in your own business, in your business. Why? Because we are talking about productivity, and when you become more efficient with the treatment, and you're gonna see that if you start more cases with Invisalign, the cost price will getting smaller as well. And if you don't see that much these patients, if you have a great planning, if you don't need to scan or take impressions again to go to the refinement phase, you're gonna see you are making money. If your patient is happy with all these efficiencies, and you're gonna have more new clients. Anyways, it's just like that. That's a sequence, of course. That one thing move another thing. And so I think I get these 5 important points for you, and I got my point. How important is to study and learn and keep studying and keep improving your skill with the clean check and with this digital plan. And remember, I have some points here. The Invisalign, it's a new technique. It's a new technique. If you see here, for example, I'm gonna not this. Let me see here. I wanna show you this here. If you're gonna have some papers, let's to check. Just to give you a brief idea, if I put like Invisalign orthodontic, and let's see how many papers we have been published so far. See, it's 123. So it's a brand. We are talking about 10, 15, more like almost 1905, and we know almost 20 years in technique. If I put like Damon, for example, it's kind of new to Damon Orthodontics, following the same keywords. We are gonna have here, see, 124, just one more actually. And in the other hand, I can put over here some other topic like orthodontic surgery. Let's put orthodontic surgery. And now we are talking about 3,900. So that's the difference. That's the point I'm telling you. We have a lot what you studied, and we have like a bright future with the Invisalign, with the digital planning, and that's the place, that's the direction to go. You know that. So just the certified courses that they usually offer, you go once in a while. Believe me, that's only the driver's license, and we are running like Formula One race with our office on the market. So we need to be really expert in this topic, and of course that's change. If this digital planning with Invisalign aligners, we are change the way we do orthodontics. We needed to change the way that we teach, like I'm doing now, and the way you learn, because it's a completely different in way to learn how to plan inside the screen. I would say you don't have to touch anything else. Sometimes you don't have even the patient near you. I do my plannings with a different continent, so they are far away. Of course, I have assistants that work together to make this party work really well. And to end this conversation, remember, to ride a horse is different like to drive a car. So when we are moving and for different ways of transportations, I'm talking about the horse and the car, was the way you feed your horse is different than the way you're gonna feed your car. And so the way, if we have a different technology, we're talking about a completely different technology to make and to apply orthodontics and for our patients. And of course that you needed to break all the rules that you had on the past just to get from with this new car, I would say, and how fast you can drive a car and how fast you can go with your horse, for example, and how often you need like to feed a car or to feed a horse, and how often you need to feed your car and where you're gonna keep. So you get the point. We are in the same way with the orthodontics. We most of the orthodontists, they haven't seen this yet, but we are in the same point almost, that like with one of the largest change we're gonna have in orthodontics, I would say, like in the last century, because for 100 years we just put different, the brackets was almost the same. They were clear or better wires or self-fed or ligated. And from now on, we have completely different words. So let's keep in touch here. I'm glad to be here. I hope you guys are liking. And we're gonna have contents and some videos in Spanish, in Portuguese, and most of them will be in English. We'll be happy to help some questions. If you haven't, you can help us to share this channel, and anyway, or if you have any questions, I'll be glad to answer. Anyway, it depends on the language I'm trying to answer you guys. Okay, so let's keep in touch. Welcome one more time to Invisalign for Doctors channel.